Hi, my name is Sarah and I work at the Care House, and I want to take you through a day in the life of some of the Care House staff during this COVID-19 pandemic. About 8 weeks ago, we decided to go down to half staff in the office each week. So we split the team up into 2 teams, and that way if somebody does get COVID-19, we're not all down and out being quarantined. Children can still be seen. The weeks that I'm in the office with the team that I've been assigned, I'm actually sitting up front. Normally my role would be outreach coordinator, so I'd be in the back sharing an office with a volunteer coordinator. But this week I'm in the office, so I'm answering phones, I'm sitting up front, I'm gonna help with medical exams, I'm gonna be the medical assistant this week, and I also do any kind of intakes or anything that the front desk requires. So we're trying to get people to fill out paperwork ahead of time, or if we don't get them to fill out paperwork ahead of time, if we can't reach them via DocuSign, we have one of our staff members walk out to their car. They have to wear a mask, and they fill out the paperwork at their car, and then we go and we get the forensic interviewee, the child who's being interviewed, from their car after the paperwork's been done. It's very strange to have an empty waiting room all the time, but we're still cleaning it on a regular basis because every now and then we do have a child come in here because they're either waiting for a sibling to finish a forensic interview, or maybe they're in here for therapy because telehealth is not a good thing for them. So we are cleaning the lobby on a regular basis, and when we do, we wear masks and gloves.
So I just finished a forensic interview and I am just cleaning the room for the next client.
About 90% of our clients have had to move to telehealth. I mean, there are some clients who are good candidates, so I have 1 or 2 that are coming into the office, but some of them, they aren't good candidates for telehealth and they don't want to leave the house, and so it's been hard getting them access to the services that they need.
So you can kind of see how we handle things in the office. Our therapy clients have gone to telehealth. We're doing a lot of cleaning in between forensic interviews. Now I want to show you what it looks like when people are working from home. Some of our desks and our offices from home are just the dining room table, or as you'll see in one place, one person had a therapy session on a bench. We do what we have to do. Check it out.
Meg Temple. I'm with the Care House. So I wanted to show you a little bit about where my workspace is now that we have the coronavirus. So when I'm working from home, we've all just kind of had to make things work and get figured out. So here is my new office. This is my husband's office, and with the coronavirus, we have moved things around a little bit. This is kind of the best option for workspace. So we've moved and added a desk over here for me, and it works out well, again, as long as my husband is not here working during that time period. When he is, then, again, I kind of have to find somewhere else. And then McGuffey is, it's coronavirus has impacted McGuffey as well, because where normally he would be at the office every day, he has now been home since the middle of March and not working. So he's not been able to provide service because of so many of our kids being seen out of the office, but also because there's not a way to sanitize the dog. So that's kind of the changes that we have had in my household since all of this started. It's rained a lot the last week here, so it was the day that the kids were inside, and so this bench on the stairs became my office space for one of my clients. So again, that we could have privacy. So it's really kind of a puzzle piece working out where's available.
So because we are doing half the team in the office every other week, the other half is working from home. So when I am home, I get a little bit more done, but I also have a toddler, so it's hard for me to juggle that sometimes. So when I'm home, my role as the outreach coordinator takes precedence. And so right here I'm editing a video, and then I kind of watch Facebook and social media all day long. Behind me, I have my to-do list of things to do for our event coming up. And as outreach coordinator, I do a lot of kind of event planning and donation management, things like that. And so I live my life in binders, and notebooks and different things like that. So I have a suitcase that I have packed and I bring with me every week. I bring it home with me. And so you can see it's quite full. And that's how I manage my life when I'm at home.
This pandemic has been really hard on everybody, especially child abuse victims. But this is why we're here.
With COVID, we've adjusted because the main important thing is to continue to provide hope, help, and healing to victims of child abuse. We'll do anything to continue to serve.
I feel committed to putting children first. So working throughout this pandemic has been extremely rewarding.
No child should be forgotten during this time. So that's why we do what we do. And that's why I enjoy it. And so we're managing it the best we can. And one quote that I've kind of come across during this time is social distancing forces us apart, but compassion defies the distance. And I absolutely love that. I actually put it as our Facebook cover because it's totally true during this time. Our compassion is defying this distance. And I work with such great people that it doesn't matter. It doesn't matter what tomorrow holds. I know that I will be working for these children.
Child abuse doesn't stop, so we're not going to stop working and we're not going to stop helping these kids.